light is too bright. Oh my goodness, I gotta turn that down. Good morning. Am I here? Am I here? I can't even tell. Okay, I think I am. Okay. I think I'm live. I hope I'm live. Is anybody there? I think I'm live. Okay. I see 3 people here, but I don't see any comments, so I hope you're with me, and I don't know what that means there. Oh, there we go. Hello. Hi, Megan. Good morning. I gotta fix my thing here. Hi, Steph. Good morning. Thanks for joining. Hi, Sheila. How are you? How is everybody this morning? I'm gonna see if I can figure out the whole. How's the snow? We're getting a foot. You're getting a foot of snow? Really? Oh my gosh. Ours, it's a sunny day here. It's beautiful. Sun is shining, the snow is melting. It's awesome. I am well. Thank you for asking. Love your information, RN in New Hampshire. Hi, Marilyn. Thank you for being here. Thank you for joining this morning. Hi, Joycey. Hello there. Did everybody remember to set your clocks? What do we do? Set them ahead, right? Turn them ahead. So then you have to get up an hour earlier. Or no, wait, how does that work? So daylight saving times. So this morning when I woke up, it said it was 7:30, but it was really 6:30. Spring ahead. My husband always says, spring back, fall forward. Spring back, fall forward. Hi, Michigan. Hi, Teresa. Hello there in Ireland. Glad you could join. My brother's been to Ireland a few times. He absolutely loves Ireland. I think he'd like to go live there. He's been there quite a few times. Took my daughters there when they graduated from high school. He took each one of my daughters on a European trip. Hi, Amy in Arkansas. Oh, you were able to block keywords. Good, that's great. Hi, Billy, and oh, Nova Scotia, Canada. I'm glad you could block keywords. Most people who come onto my YouTube lives are a lot nicer than those who come on my TikTok lives. But I did notice recently I had a lot of very nasty comments on a video that I posted where I talked about hospice for pregnant people, and I use inclusive language because I'm a nurse and I serve all walks of life, and it's important for me to be inclusive, and people were really calling me out with some pretty hateful comments on that. Hi from the north of England. I'm also a palliative and end of life nurse here. Awesome. That's great. I actually received a message this morning, an Instagram message or a Facebook message, and it was from a hospice nurse in Scotland. And so I was very curious about that because I love to know what the hospice medical care and benefit is like in other countries. And she said that in Scotland, some of them are allowed to continue treatment, and also that it is free healthcare for everybody. So hospice is free for everybody, and that there's not necessarily a requirement of a 6-month or less life expectancy. So I thought that was kind of cool. Tracy, I served as a hospice nurse for 20 years until I had to retire due to disability. I am partially retired. I have a job now where I work from home as a hospice quality manager for a large hospice agency, and I work 3 days a week. I'm partially retired, and I love it. Living off the grid in a cabin takes a lot of work. And so I just realized I needed to cut back on my hours. Plus, social media takes a lot of work, and I am writing a book too. How does it work when someone's lungs fill with water? It happened to my granddad, and he got the liquid sucked out with the machine. He was sent to hospice. So, if you're talking about when people have end of life terminal secretions or congestion, or also known as the death rattle, that is happening because people who are getting close to their death are no longer swallowing anymore, and their secretions, like spit, builds up in the airway, and the air moves over that and causes that rattling noise. And it can sound like a person is filling up with fluids and going to drown in those secretions, but they're not. One of the things about suctioning that is not good in that situation is that when we suction somebody, like when we put something into their body that is a foreign object, the body responds by making more secretions. So, suctioning people often will create more secretions. Hi, I admire you so much. My mom is on hospice in lung and heart failure. We are in South Carolina, but my mom is so young and it sucks. We absolutely adore you. Hi, Jamie. I'm sorry about that. Um, what my mom is on hospice for 14 months and they gave her 6 months that long ago, and we are here in South Carolina. So she has exceeded that 6 month life expectancy, and lots of people do. Death is unpredictable, and there are studies that show that when people go on hospice, sometimes they live longer than they would if they had not gone on hospice. My mom experienced changes in breathing only at night. Is that normal? The changes in breathing can come and go. I've never really noticed that they have anything to do with the time of day. I will say that more people die statistically at night than during the day, which is interesting to me. Do you ever get scared at work? Like, do you see death and worry for your own, or has it given you a deeper understanding and level of calm for when you pass? Yeah, actually, I had severe death anxiety before I became a hospice nurse, and being a hospice nurse helped to alleviate that death anxiety. I don't have any fear of death. Um, I'm not looking forward to it. I'm like anybody else. I'm not like, ooh, I'm so excited. I can't wait to die. But I also do have this calmness about knowing that if I'm dying a natural death and I get to experience deathbed visioning of people who have died who I love, like my dad and my cousin who killed herself when she was 25, and anybody else who dies, in between now and my death, that's comforting to me to be able to see those deathbed visions. So not scary at all to work in the field of death and dying. It's actually makes you feel better about death and dying. My aunt who was dying of cancer was spitting a black liquid. I'm wondering what that was. It sounds like potentially a bleed out. That's usually what blood looks like. A lower GI bleed is vomiting up black liquid. It also could be fecal matter, although usually you can tell by the smell that it's fecal matter. My dad has been diagnosed with stage 4 lung cancer. I feel like I've pulled away from my father ever since I found out about the diagnosis. I feel horrible about it. Is this normal? It is. It is normal for people to avoid being around somebody when they learn that they are very, very sick, or especially if they're going to die. It's hard, especially if you're a young person. I think it's hard because, you know, well, I think it's hard for anybody because it does tend to put mortality right in front of you. Um, and to me, that's kind of when death anxiety really starts to set in. Is the first time you actually start to be aware of your own mortality. So it is hard. It's hard too because you don't know what to say to that person. You don't know if they want to talk about it. You don't know if you want to talk about it. So it's normal if it's a recent diagnosis. Give yourself a minute to absorb, um, and hopefully you'll be able to come around and be with him if that's what you want. And sometimes too, people don't have a good relationship with their parent or their sibling or their child who is dying, and they don't want to be around them, and that's okay too. Death is not death does not absolve a person of sins. Not saying that that's the issue with your dad, but if for people who are like not wanting to be around somebody because you had a not good relationship with them, it's okay to not want to be around them just because they're dying. Does being on a ventilator and being sedated mask regular dying occurrences like reaching up or making any noises? Well, a ventilator and sedation is life support, so it's keeping a person alive. Um, I am not sure, like, if they're actually. I haven't been around people who are on a ventilator and sedated because I'm a hospice nurse and that happens in an ICU. So I don't know if they do that, but I would think not because, again, they're not dying, they're being kept alive. They're also being suctioned a lot, a lot, a lot. So if they were going to be, having those terminal secretions, you wouldn't notice that as much because they're going to continue to suction them constantly. My dad was on hospice for a month when he passed 6 years ago. I'm always worried that my mom will have to go on at some point. She's at the beginning stages of Alzheimer's. So, Billy Joe, yes, she will have to eventually be on hospice unless she dies a sudden death. But with Alzheimer's dementia, that is a terminal condition. It is a insidious and lengthy prognosis to time of death. So people who have Alzheimer's don't end up going on hospice for quite a long time because the decline is so slow and they don't meet that life expectancy of 6 months or less until they are, at the end stages of their disease. My mom was in hospice for 6 weeks. She passed last November 10th. You helped me so much. I had one question. Are they in distress when they are gasping? No, there is no reason for us to believe that people who are having that very normal end of life breathing pattern where they're really pulling on air are in any distress whatsoever. So we are able to assess whether people are uncomfortable by looking at their face. People who are not comfortable are usually going to be kind of furrowed in the brow, grimacing, and we don't notice that when that person is dying and having those end of life breathing patterns. They are um, unresponsive at that state. You could make a forum for hospice nurses, not just people who are new to hospice or non-medical people. I could, but I am so occupied with keeping up all my socials, and I am on all the socials. I'm on TikTok, Instagram, and also Facebook. At Hospice Nurse Penny is my username on all of the socials. So if you are on those, follow me there too. All my platforms are a little bit different from each other. Um, if a hospice patient doesn't die after months and months, they can continue to stay on as long as they meet the criteria of a life expectancy of 6 months or less. We don't kick people off just because they've lived that 6 month time frame. We continue to reevaluate, and as long as they always have a life expectancy of 6 months or less, they can stay on. What happens to people that smoked most of their life? Is their death more painful or is it harder to breathe? So, if they have a smoking related illness, whether it's their terminal condition or not, if they have lung cancer or COPD or emphysema, then usually the symptoms that they're going to experience are going to be shortness of breath. They can have pain as well, especially with lung cancer. People can have pain like in their back when they have lung cancer. Um, and we are able to manage those symptoms really well by using morphine. Morphine is the gold standard for treating shortness of breath. It works really well to slow the respirations down and let people feel like they can catch their breath. My mom wants me to ask you, is it normal to be afraid, even though she is aware that she is going to pass, but she is afraid to leave us, her kids, behind because people tell her she shouldn't be scared? God, I don't know why that just got me in my feels right now. That really got me. I don't know why. People should not tell her that she shouldn't be scared. It's normal for people to be scared at the end of their own life. And it's especially normal for people who have children to be afraid for their children. That is something that's very normal. I've heard many of my patients tell me that when we talk about, do you have any fears? It's usually one of two things. One, I'm afraid what dying will be like for me. Is it going to be painful? Or two, I'm afraid about what's going to happen to my family after I'm gone. And one of the things that I always love to be able to tell my families or my patients is that hospice supports the family for up to a year after the death of the person with grief support services. So we keep an eye on people to make sure that they are coping okay after the death of their person. It is normal. It's totally normal to be afraid and to be worried about your children. And the best way to really, I think, work through that is to not wait to have conversations about, you know, the important things that you want to talk about. Not to avoid the topic of dying and death, not to, skirt around that issue, but to actually, have your one-to-one conversations with your children about anything you need to talk about, all of um, the life advice that you want to give. Sometimes patients will write cards to their children, like for their occasions that may happen in their life, like graduation or marriages or, that type of thing, or write letters. And that can also be very cathartic and help to work through that fear about what's going to happen. That really grabbed me this morning. I feel that death is a beautiful thing. Going peacefully is a blessing. I wish everyone could and will experience. Nobody gets out of this alive. Alive. So true. So true. Nobody does. And that's why I think it's really important for us to talk about it because, when we avoid the topic, it just creates anxiety and fear. And it also doesn't allow for us to plan for a good death. And by that, I mean, making sure that you get all your business that you need to take care of taken care of. Make sure that you say your goodbyes. Make sure that like I love legacy work for that, like going through the things that you've collected over the years, important things, mementos, pictures, whatever, and being able to write down what those things are, who they're for. I think that's really important. Quick question. Would you go in there as a young person if you were about to die soon? So hospice is not a place, it's a type of healthcare service. And yes, we get young people on hospice all the time, and hopefully not just when they're about to die soon. We like to get people on service as soon as they qualify, which is when they have a life expectancy of 6 months or less. But yes, it's for people of all ages. Hospice is not just for old people. It isn't just old people that die a natural death from a disease. We have lots of pediatric hospice patients, so children, pregnant people who have babies that are not viable can be on hospice, or for the pregnant person. Um, I have a patient that's been on hospice for 2.5 years. The PA said as long as she is declining, they will keep her on hospice. That is true. As long as a person continues to meet that life expectancy of 6 months or less, they can stay on hospice. What would you do if a patient is actually allergic to morphine? A true morphine allergy is actually quite rare. Typically, people have side effects from morphine that make them think that they have an allergy, like itching or sedation. And that is a normal side effect that will eventually go away once a person adjusts to that. So a true morphine allergy is rare, but we do have other medications that we can use if a person is allergic to morphine for real. Is it normal to have oxygen around 80 when the actively dying process is speeding up? So I just want to say, like, checking a person's O2 sats when they're dying, like with that little thing that goes on the finger, is so very unnecessary. There's something called the oxyhemoglobin curve. I want to say oxyhemoglobin curve. So at the end of life, those readings can be wrong, and they're not going to drive our care. We don't care what the numbers are. If a person is short of breath, and their oxygen sats are 90%, we're still going to give them something for their shortness of breath. If they're not short of breath and their oxygen sats are 65, we don't need to give them anything for that. So it doesn't really matter what those O2 sats are when a person is dying. Quick question, would you go in there as, oh, sorry, I just saw that one. Did you experience people under 18 in hospice? Yes, I have seen, I am an adult hospice nurse, but on the weekend I floated and I have seen a 5-year-old on hospice services. I wish I'd known about the post support because we didn't get offered that when my mom passed. I'm dealing with the grief. I'm so sorry about that. And if it's been within the last year that your mom died, you can still reach out to the hospice and get that support from them. Um, I it is a Medicare requirement, and they're supposed to do a grief risk assessment after they actually are supposed to do a grief risk assessment when the person is admitted to hospice, and then after they die, they do another grief risk assessment, and they are required to offer those services by Medicare in the US. Oh my gosh, I didn't know about the support after death either. Wow, I am really bumming that I'm hearing this because it's a Medicare requirement. So, if any of you have somebody who is on hospice or going on hospice, a really valuable resource to you is the NHPCO, nhpco.org. It's the National Hospice and Palliative Care organization, and they have a site where if you're a patient or a family member, you can go in there and they have all kinds of support and help for you. They can like direct you to who you need to complain to if you're not getting what you need from your hospice agency. It's a really great website. Hello, I'm a new grad RN working on a floor where rarely we will get a hospice patient. What would you do if families tell you that they don't look comfortable by the way the patient is gasping, etc. So again, we have to assess to make sure they really aren't comfortable, and that is to look at their face, make sure they're relaxed, make sure they're not moaning or making any kind of noise that makes us think that they're uncomfortable. And then we can ask I like to ask families questions first before I try to give them any information. So I ask them what makes you think they look uncomfortable. And if they say the breathing looks uncomfortable, and then you do your education, that's a really normal end of life breathing pattern. I can tell you, I've been with, thousands of families who were with their dying people. And when you are able to normalize a dying symptom, people are really relieved by that because they do worry when they see something that their person is doing that they've never seen before. It does make them worry. So if you can alleviate that worry by explaining this is a normal end of life symptom. We have no reason to believe that they're uncomfortable. You can see the face is relaxed. You can see they're just doing a normal dying process. And if they're not comfortable, you medicate them. I love you. This channel is so necessary. Thank you so much. Do you ever have people die with no family at all? Yes. Yes, we do. I'm so grateful for your channel. Love your honest personality and sense of humor. Thank you so much. I like to bring a little levity to the topic of death. It's a very dark, scary topic for a lot of people, and I like to make light of it. And I think humor is a really important coping tool. Most of the nurses that I know, most of the people that I know that work in hospice have a great sense of humor. We use dark humor a lot for coping, and a lot of my families and patients have used dark humor for coping. They're my favorite kind. Patients who joke about their own death are like my favorite people to be around. You helped me so much when my father was dying in December. Watching your videos and shorts helped to prepare me for the end. He was on hospice 2 months. Thank you for sharing knowledge and experience. Thank you, Nana May, for saying that. I'm so happy to know I was helpful. Thank you for answering that question. She just heard every word you said. It meant so much to her. Thank you, Jamie. Thank you for reaching out. I'm glad you're here. A 5-year-old on hospice. Oak my heart. Yeah, lots of children on hospice. My brother was told he had 4th stage cancer after hurting for several months, and they told him it was nothing. Within 3 weeks, he was gone in hospice in Maine. Oh, I am so sorry. Most people with stage 4 cancer do not survive it. I just want to tell you. Do you work independently or through another business? I work for a hospice agency. Hi, Hospice Nurse Penny. My name is Matthew, and I can't possibly explain how much you've helped me. I used to have major death anxiety, and you've helped me so much to the point where I'm not afraid. Thank you, Matthew, for saying that. Man, I don't know what's up with me this morning. Maybe it's the time change, but you guys are kind of choking me up a little bit today. Hospice nurse here. I hate how terrible some nursing homes are. They basically expect us to be there 24/7. Yeah, we really have to manage expectations because people do think that hospice is 24-hour care, and it's not 24-hour care. I have death anxiety too. I don't know how to deal with it. I'm scared of death too. So normal for people to have death anxiety. Very, very normal. And I didn't know that until I got on TikTok. I had no idea that it was normal. Now I have OCD, and so I didn't know if my death anxiety was a part of my OCD. But I had it really bad when I was in my early 30s. Like all of a sudden mortality was front and center for me. I just realized, oh my God, I'm getting old. Look at me. I'm in my 30s. And I really had severe death anxiety. And I always joke that my ex-husband is probably my ex-husband because I would tell him I was so worried about what happens when we die. What if there's just nothing after we die? And he would say, well, it won't matter because you'll be dead, so you won't know. But, I just really had a lot of fear around death. It was crippling for me. I sometimes couldn't even sleep. It was really hard for me. And working in hospice and being like connected to death, seeing people visioning their deceased loved ones and pets at the end of life really helped my death anxiety. The more we talk about it, the more that we're open to it, the more that we accept that it's a part of life that we cannot avoid, the easier it becomes to deal with and the less fear that we will have. My dad has stage 4 lung cancer and end stage COPD. Hospice has been brought up, but he won't accept any advice. Um, so is he willing to even maybe sit down and talk with somebody from hospice? I always, again, like I love to ask questions like, what are your concerns? Like, what would it hurt for us to meet with somebody from hospice just to see what kind of advice they have or information or what they can do to help? Um, Usually people are going to say that they're afraid it means they're giving up. And we always say it's not about giving up hope, it's about changing what hope looks like. They say that they're worried that it's going to cause them to die faster, and it's not. People die on hospice from their disease. There are studies on lung cancer patients that have shown that people that went on hospice with lung cancer lived longer than people with lung cancer who did not go on to hospice. If he is wanting to continue to seek treatment, then he wouldn't be a candidate for hospice. But definitely, ask some questions like what are his fears around that? And maybe we could just meet with. And the other thing, too, is that hospice provides a lot of support for the families. And so sometimes when people who are faced with their terminality and needing to choose hospice or not choose hospice, when they understand that hospice is going to be there to support their family, they're a little bit more willing to um, consider it. Can you overrule someone's decision to not have a DNR when they're terminal? My dad didn't want a DNR, but I told them to place DNR because I didn't want him to suffer after the doctor said he won't make it. So a person who is decisional makes their own decisions. Even if you are a durable power of attorney or the next of kin with legal decision-making capacity, you don't get to make a decision for somebody if they're decisional. But once they become no longer decisional, then yes, you can make that decision for them. And if you're acting in their best interest, which doing CPR on a dying person, or rather a dead person who has died of natural causes, is not acting in their best interest, it is better for them to be a DNR, then yes, you can make that decision once they cannot choose for themselves anymore. And oftentimes what happens is people don't, especially like the older generation who's been through like the advancements in medical care and seeing that people can be kept alive a lot longer through medical treatment, that generation of people is very hesitant to choose to be a DNR. It's just like their generation, right? And so what happens is they stay full code and they're in their home. And then when they die, the family just chooses to call hospice and not call 911. And it's not really about not honoring their decision. It's about doing what's in the best interest of that person when they really didn't understand fully what it meant to have CPR on their dead body. Because CPR is only done when a person has died. I had two young boys when my husband died, and we were not offered help after his death either, but my husband had wonderful care. So sorry that you weren't offered that grief support. You know, it is a requirement for hospices to provide grief support services. My wife, 7B, dementia. I have advanced directive, would like to tie those together and use VSED. About to consult an attorney in this matter if I can find one who wants to take it on. So if your wife is living at home, then there's not really much more you have to do with that other than to not offer food or water. But if she is in a facility, then you will have to get probably an attorney to do that for her. You could also try to take her home on hospice, but that's not always feasible. You know, if you work, it's hard to be able to care for someone 24/7. Um, but that is something like I've talked with my mother about. My mother does not have any signs of dementia, but she worries that she will get dementia. And we've talked about that. Do you want to be fed? If you can no longer feed yourself, do you want to be fed? And she has said, no, I do not want to be fed. And nor would I. I don't, if I can't feed myself, I'm a foodie. I love food. If I'm not feeding myself, and this is on my advance directive, if I have a disease where I am not able to feed myself anymore, don't feed me. I don't want to be fed. Is it normal to have a scab on the tongue at the end? Is this a terminally ill patient? Also, signing up to be an organ donor also helped me because it forced me to realize that I'm going to die someday. But maybe I can live on in some way by helping someone else who needs an organ. That's a great philosophy. I also, you know, like if you're on hospice, you can't donate your organs, but you can donate your corneas to Sight Life. In your hospice, do hospice nurses tend to be older? I feel like a baby being a 30-year-old hospice nurse. I've worked with some younger hospice nurses, but most are a little bit older because you really need some experience to be a hospice nurse. I'm freezing cold this morning in here. What's the difference between DNR and full code? DNR, do not resuscitate, means when a person has no longer has a breath or a heartbeat, that we will initiate resuscitative efforts like CPR and intubation. And I'm sorry, will not. Is that what I said? Will not initiate resuscitative efforts. Full code means we will do everything to try to resuscitate them. My grandma had a dog called Puffy. She sold him 1 month ago. She regrets it so much. I'm also really sad and angry at my grandma. I had a really strong connection with my grandma's dog, and it feels like I didn't catch the rest of that. I sometimes feel like I hear him scratching or bark or walk. I love your channel because I too had severe death anxiety after being with 5 family members who passed. I lost that fear. Thank you. Thank you for saying that. Thank you. Glad I was helpful. Mom was actively dying and stopped drinking. I used sponges for oral care, but she developed a scab on her tongue. So even doing oral care, you know, sometimes the mouth can really dry out and people can get, you know, a dry tongue can make a sore on the end of it. I'm glad you were doing really good oral care though, because that's very important at the end of life. Ever think of opening your own hospice agency? I have not ever thought of that. No, don't. Too much red tape. In my state, we have a certificate of need. It's a requirement to open a hospice agency in Washington State. So yeah, no, never have thought about doing that. Is it normal that I hear my grandma's dog, even though he's gone? I couldn't say. I'm an end-of-life nurse. I don't really know anything about that. Tell us more about your life story. How did you become a nurse? Oh boy, here we go. This is going to be a little bit of a journey. So I, in my younger years, was a partier. I was a drug addict. I was an alcoholic. I went to jail a few times, gave my son to his dad to raise, um, cleaned up my act when I was 27 years old, got my son back in my life, had a second marriage. Um, and then at the age of 40, after 10 years in my second marriage, my ex-husband and I decided to get divorced, and I needed a career. I had only been a, bartender, vet tech, lots of things in my life, nothing where I could really afford to, have my own income. And he couldn't afford to support us both. So, his stepmother-in-law had died when she she was 56. So like the year before we made this decision to get divorced, she had died on hospice with cancer. And the nurses to me were like, it was sacred work, really, really amazing work. And thank you, Mike, for the gift. Thank you so much. Um, so I knew like that I wanted to be a nurse, and I knew I wanted to do service work because of my earlier life choices. I felt like I needed to do something that was serving people to kind of give back to the universe. So I'd had this experience with my soon to be at that time ex-husband's mother, stepmother, and felt like that was the kind of work that would be service work. I also, at that time, had seen on the news a lot of nursing homes were having abuse by nursing staff. And so I thought it was going to be one or the other. I either want to go into a nursing home and make a difference, or I want to go into hospice. So I became an LPN at first, and I did not know LPNs can work in hospice. So it was my ultimate goal to be a hospice nurse, eventually to be an RN, but I needed a fast track to be able to get divorced. So I went to school to be an LPN when I was 40 years old. So I'm a late bloomer. I became an LPN, and I started working in a family practice clinic. If you're a nursing student and somebody tells you that you have to go to work in a hospital because you're going to lose your skills, that's total bullshit. You go work wherever you want to work. You don't have any skills when you graduate nursing school, okay? I gave a shot to an orange and I put a Foley catheter in a dummy. I had no nursing skills to lose. I went to work in a family practice clinic. I learned so much about medications, about assessments, about, checking vital signs, about labs, all kinds of things that I learned. But after a year, I decided that I really still wanted to go on forward with my path to be a hospice nurse. Because at that time, that's kind of what I decided through working with in the clinic and talking to hospice nurses on the phone, kind of made me like, okay, that is what I want to do. So I decided to go work in a hospital so I could get a little bit of actual, sick patient care experience. Well, in hospitals, they often will do like a cyclical layoff. Every 10 years, they're like, yeah, we don't need LPNs anymore. Let's lay them off. Then they always realize what a mistake it was and they hire them back. But I just caught this little layoff. And so after 3 months, I was laid off. Now, during this time, I had been divorced and started dating somebody new. And there was a hospice care center that was going to be opening up in the neighborhood of my then boyfriend, now husband. So I got laid off and I decided that I needed to get another job and why not see if they're hiring LPNs? And they were. So I went to work in this hospice care center and I worked there for 5 years. And during that time, I got my RN. And I was told all the time that they would hire me as an RN. But then when push came to shove and I was about to graduate and I said, do I apply for a job? What do I do? They said, oh, actually, it's our, and this was a big organization. It's the organization's policy that you have to work for 3 years as an RN to be a hospice RN. So I was devastated. I ended up going into the ER with the same organization for 3 months. Fucking hated it. Went home crying every night. Hated it. It was completely opposite from the end of life care, obviously. And also, the nurses were the kind that ate their young. So they were very, very unnecessarily cruel to me, and I hated it. So then my dad was dying. So I took a couple of weeks off to be with my dad while he was dying. And then I got another job at another hospice inpatient care center who just snapped me up. And I stayed doing that for another couple of years. And then I was recruited to another agency for home hospice as a case manager. And I've just worked my way up. and got my BSN. I've been certified in hospice for 12 years. I now work in hospice quality. I'm a manager in hospice quality, and I know a lot about the regs, hospice regs, education, all of that. So that's my nursing journey. And thanks for asking. I love sharing that. And then my social media journey is that in 2020, when we had the pandemic lockdown, I was trying to learn how to shuffle dance. And on TikTok, I discovered TikTok. I was trying to learn how to shuffle dance. And then I saw other TikToks where people were telling stories, and I told a hospice story, and it went viral. And I realized that this could be helpful to people, like a grassroots. I'm a very passionate advocate for hospice and end of life care, partially because I did have death anxiety, and it helped me so much. And then it was through TikTok that I learned that other people have it too. Hi from the UK. I've been an end of life senior carer. So many people are so scared of making decisions for their end. I'm hitting 40 next month. Still don't know what I'm supposed to be doing. Yeah, it takes us a while sometimes, right? Took me a long time. Can you sing? Everyone says you sound like a rock star. I never saw a video of you sing. I do sing on my TikTok lives sometimes. So if you're on TikTok, give me a follow there. I'm Hospice Nurse Penny on TikTok. Every now and then I do sing on TikTok. um, that's why I didn't go to college when I was younger. Thank you for educating the signs of end of life. My friend's sister is actively dying and can no longer swallow. We were able to talk more openly about what's going on, and I could be supportive. Thanks. Great. I'm so happy to hear that. Yeah, so I didn't go to college out of high school because I was going to be a rock singer, and you didn't need to go to college to be a rock singer. That was my philosophy. Instead, you could just go sing in the clubs, which is what I did. Um, I went to our Navy club on Whidbey Island. It was one of the big back in the 80s. So like I said, I'm old. I'm 60 years old, and I graduated in 1980. And back in the 80s, clubs were very popular, and live music and dancing was very, very popular in clubs. And we had a club on Whidbey Island. It's a naval base, and it was one of the biggest clubs in the Pacific Northwest, and lots of bands would come and tour there, and I would hop up on the stage and sing Pat Benatar songs with them. But I also smoked, and my voice isn't what it used to be. So I find it hard being a male nurse in hospice. Would you recommend I stay a hospice case manager? My other experience is critical care for 5 years. Um, why do you find it hard being a male nurse in hospice? I know lots of male nurses in hospice, by the way. I think they're wonderful. And I know I've known a lot of male nurses who were hospice nurses, either floats or case managers, who the patients loved them, especially the women loved. We used to have one who, like, he was really, really funny, and our patients, our older women patients, and family members loved him. He was super funny. Thank you, Carolyn. I'm trying to move to Whidbey Island. Small world. Wow, yeah. If an unresponsive hospice patient is jerking, does that mean he's anxious, or is that normal? So that could be a sign that they have developed opioid toxicity, which can happen when people are on opioids, and it doesn't matter what the doses are. A person can be on massive doses of opioids without having opioid toxicity, or they could be on a little bit and have opioid toxicity. So it's really important to, one, let your nurse know that you're observing that, and two, to really make sure that their pain is well managed. The hallmark sign of opioid toxicity is an increase in pain in spite of an increase in opioid pain medication. So if your person is twitching, jerking, and they look uncomfortable, they're, like creased up here, grimacing, moaning, then that could mean that they have opioid toxicity. And it's a really easy fix for that. We just rotate the opioid. So if they're on morphine, we switch to Dilaudid. If they're on Dilaudid, we switch to oxycodone. So it's a really easy fix if that's going on. Pulmonary fibrosis, 10 years. Doctor says I don't qualify, can't get my VA. Doctors say don't need it can walk 1 mile. Is that why you please explain why it makes you qualify? You have to have a life expectancy of 6 months or less to qualify for hospice. Um, Pulmonary fibrosis for 10 years, that's a long time. There are some for like end stage respiratory diseases, there are certain criteria that have to be met in order to qualify and to meet that life expectancy of 6 months or less. But that's great that you've been able to live for 10 years. My dad actually died of pulmonary fibrosis, and he died within, I want to say, 4 months of his diagnosis. Sometimes I'm afraid of being alone with patients, especially female, just in case they say something. Since case managers are alone most of the time, makes it hard doing weekly skin assessments. Yeah, if you are concerned about that, you definitely want to have family present. You can do joint visits with your hospice aide, um, but I can understand why you might be concerned about that. That could be a worry. I think most people are not going to do that, but you can't. It could be something a consideration, like doing joint visits, or having somebody present. So if your patients are in a SNF, like in a facility, then get one of the staff nurses or the staff aides to come in with you when you're doing that kind of care. Amazing, strong, wonderful story. Thanks. You give many courage. You're amazing and are a wonderful example of anything is possible. LOL. I also graduated in 1980 and live in Washington State. Oh, Kristen, awesome. Where do you live? I'm curious to know. I graduated from Oak Harbor High School. So opioid toxicity again is when somebody is not able to tolerate the opioids that they're on. That's in a nutshell. That's what that is. Hey Charlotte, I don't really appreciate any kind of proselytizing. I appreciate that you're thanking me for helping so many people, but hospice is non-denominational, so we don't proselytize on here. I had acid, my lung surgery. Guess fixed it. Thank you for the answer. Oh, your lung surgery fixed your pulmonary fibrosis. Oh, that's good. Oh, my dad's could not be repaired. So, so proselytizing is something that's not allowed in hospice. We serve all different walks of life, all different religions, and we serve people in the whatever their religious or spiritual choice is. Thank you, Delicate Dreams. So I have another like interesting part of my story that you guys might be interested in. But before I go on, in case you're not already subscribing, I am Hospice Nurse Penny, and so subscribe to my YouTube. I'm a certified hospice and palliative care nurse. I've been a hospice nurse for almost 18 years, and I like to talk about death and dying and normalizing that. And I talk about hospice also. I'm on all the social media platforms, Instagram and Facebook and TikTok. Hospice Nurse Penny is my username across all of my platforms. I just moved with my mom to my son's house in Cedar Woolley. I've been caring for my mom alone for 6 years with her dementia. Oh, wow, that's a very long time. Hi, Scorp Comic. Thanks for joining. So the other little part of my journey that I was going to tell you about is kind of amusing. So when I decided to go to nursing school back in 2021, um, or 20, it was the year after 9/11 that I went back to nursing school. I think that was 2021 or 2022. Anyway, um, my ex-husband was in the military. He was enlisted in the military. He was a staff sergeant. So we didn't really qualify for a lot of financial aid because he was in the military. So we didn't make very much money, but just enough where you don't really qualify for financial aid. So, I had seen this woman who started a website. Now, this is back in the beginning of the internet, right? Like there was no social media back then, no Facebook, no TikTok, no Instagram, no GoFundMe, nothing like that. But this woman had started a website to try to raise money to pay off her credit card debt. And I saw the story about this and I thought, well, wow, if people are going to help her pay off her credit card debt, maybe they would be interested in helping me pay for nursing school. So I created a website called helpmeleavemyhusband.com. And it blew up. It got worldwide attention. I was on all kinds of radio interviews with like Irish national radio and in the UK, and my website was mentioned in all kinds of newspaper articles. I was in Time magazine. I was on Fox National News. I was on all kinds of local news station shows. I was on The Other Half with Mario Lopez and Danny Bonaducci, and I was on The View with Star Jones and Meredith Vieira. Barbara Walters was not there the day that I was on. But anyway, so I had like a little 15 minutes of fame by doing this website called helpmeleavemyhusband.com. I don't have the website anymore. Once I graduated, I kind of let the domain expire, which I wish I hadn't done that, but I did. But you can still find it on the Wayback Machine. So anyway, just a fun fact. Hey, I always say, like, for those of you who have used GoFundMe, I was the pioneer in asking people for money. We were called internet panhandlers or cyber beggars. So you're welcome. If you've ever used GoFundMe, I was a pioneer in asking strangers for money for a cause. Hey, do they help with spirituality there if a patient wants it, not religion? What are some of the things that ones that have more time do there? So, in hospice, there is a spiritual care counselor requirement, usually considered a chaplain or called a chaplain. They have a master's degree in divinity, and it's required by Medicare for them to do a spiritual assessment within the first 5 days of the person being admitted to hospice. And they assess what their individual needs are around spirituality and religion. It is not proselytizing at all. And it's not about religion unless the person wants it to be about religion, but they facilitate, they either provide or facilitate spiritual and or religious care for people. Working in hospice and with our chaplain has made me want to become religious. I have zero history with religion from growing up. We couldn't have done anything without, and you are so loved. Tammy, thank you for being here. So happy to see you here. So I have like 8 minutes before I sign off. I was going to keep it to an hour this morning. One, because I woke up late. Well, I didn't really wake up late. The clock said it was late. I wasn't late. And I didn't eat breakfast yet. I'm starving. So my stomach's going to start growling in a few minutes. But if you have any last questions here, please make sure you put them in the comments. I'm also freezing. So I live in a cabin in the mountains, off the grid in Eastern Washington, and we heat with a wood stove. And my husband stoked it up before we went off to church this morning. And yes, I am not religious, but my husband's a Christian. He goes to church on Sunday morning. And he stoked it up before he left, and then I didn't do anything with it since then, and now the fire has died, and I'm freezing cold. Tammy, thank you so much. You are amazing. And Amanda and her journey, and sharing her journey was such an amazing thing for so many people. Have you heard of the Liverpool Care Pathway? It was removed due to it being seen as assistance dying. It was a shame as this was done across many professionals. Hospice care is still a thing. I have not heard of that, but I know that in the UK, medical aid in dying is not legal. Thank you so much for everything you do. I wish my mom's nurse had been like you, because it would have been much easier and easier for us to handle everything. In your experience, how many times have you seen families revoke and be accepted back on service? More than I care to. Revocation in my mind. So just for those of you who don't know, in the US, if you choose hospice, you have the right to revoke at any time for any reason. you can revoke. It's a benefit. It's a Medicare benefit that you choose to be on hospice. And sometimes people revoke because they are either seeking treatment or they cannot get the care, not hair care, they think that they need. And so they revoke. So usually what happens is either their symptoms are unmanaged and they don't call hospice, they call 911, they end up in the hospital, and then they have to revoke their benefit to be hospitalized for something that's not related to their hospice diagnosis. Or they just like they're seeking treatment. And so, in my mind, when people are revoking hospice, it's because it hasn't really been explained to them the things that we can do to prevent them from going back into the hospital. That is like 9 times out of 10, people who revoke hospice go back into the hospital and they don't understand that we can help without them going back in the hospital. And they do end up coming back on. But again, people can revoke any time they want to. Why can't you donate organs if you're on hospice? People who come onto hospice have a terminal condition, and usually their organs are non-viable. So they either have dementia or they have cancer. People with cancer are not able to be organ donors. ALS, anything like that, they're not able to be organ donors. Organ donors are typically people who die like unexpectedly, traumatically. You are amazing. Following you helped me understand a lot more about what can happen for hospice than I used to know. Thank you, Billy Joe. Thank you for saying that. Considering the drop of fertility rate in the world, do you think euthanasia and assisted suicide will be a real scenario for future elders? I'm not sure what the drop of fertility rate has to do with that. But I think really more people wanting to have autonomy over what happens to their lives and the end of their lives is going to drive medical aid in dying. And we don't call it assisted suicide, by the way. It's really not suicide. Suicide is when a person has a choice to live or die and they choose to die. Medical aid in dying is for people who are dying. They're terminally ill and they're dying. When you were a case manager, did you ever feel like you wish you could do more? I feel like I did what I needed to do within the role of being a case manager. How long does it take to pass with VSED? So the kind of the rule of thumb when people aren't eating or drinking is usually about 7 to 10 days. Sometimes it can go a little longer. It depends on how much reserve they have on their body, and sometimes they can go faster than that. My mom donated her body to science, so we didn't get any kind of like ashes back or anything like that. Sometimes when you donate your body to science, they will give you back the ashes, but sometimes they don't. Yeah, Pam the cat, Pam's fan club. Tell us about Pam. Pam's outside walking on the mountain right now. So, again, for those of you who might be new here, I live in a cabin in the mountains off the grid in eastern Washington. We have 40 acres. Our property on the west side is bordered by state land. On the north side, it's bordered by national forest. So, we are very end of the road, close to Canada. And my cat, Pam, is a little badass who likes to go outside and go on walks with us. She acts like a dog and she goes out a lot. She's my little mountain cat. And she's a little renegade. Lastly, I just want to thank you, even though I've never met you. You've made a huge difference in my life. Thank you so much for everything you do. Thank you so much for saying that. We were told that my mom could not donate her body or brain to science because she died on hospice. Oh, that's interesting. It depends on the agency. Sometimes people are very fussy about who they accept for body donation, for whole body donation. It just really depends on who you are going with. So thank you again, everybody, for being here. Again, I'm Hospice Nurse Penny on all the socials except Twitter. I did cancel my Twitter account. I'm on Instagram, obviously, YouTube, TikTok, and Facebook. Hospice Nurse Penny across all my socials. Be sure to follow me there. And if you haven't already subscribed to my YouTube channel, please make sure you do that. Thank you, everybody, for being here. And I'm sure I'll do another YouTube live again. I really love to be doing lives on YouTube because you all are so very nice and I appreciate it. So thank you so much for joining me today. And I hope everybody has a fantastic weekend and rest of the week. And remember to set your clocks forward if you haven't already done that. Bye.